Good afternoon, ma'am. I'm Shara Kim Villaplor, your student nurse from BSN 28. So today po, I will be demonstrating the nasogastric tube insertion, gavage, lavage, and the removal. So the purpose is this is to remove the stomach contents for laboratory analysis and for the assessment latency of NIRS, present of gag reflex. Then, for the planning, determine the size of the tube to be inserted. Then, for the preparations, assess the client to the high polar position. So, for the procedure, verify I confirm the patient's order and introduce yourself and verify the client's identity. So, good afternoon, sir. I'm Shara Kim Villaplor, your student nurse from BSN 2H. May I know po your name po, sir?
So,
thank you po. So, after that, perform hand hygiene or hand washing. Then, that appropriate PPE.
yung tinatanong ko siya.
Ay!
Tinatanong ko si Felix.
Ha?
Tinatanong ko sa akin. Sila tumulog sila.
And after that, prepare the all equipment and position the client. Then after that, place a towel to the client chest. Then after that, select the appropriate size of the insertion tube.
Yung start date ko nag-start, natapos ako 1:30.
Then determine the appropriate length. Then after that, cleanse the nose of the client by using the cotton with alcohol. And after that, lubricate the tube with water lubricant. after that, flex the client head forward. Then, allow the client to lower his head slightly. Lower his head. Then, after that, instruct the client to swallow as tube advances. Then check the back of the client's throat to make sure that the tube is not curled and through. Then, after that, check the correct placement of the nasogastric tube by using 2 or more of the polymin. Confirm by the X-ray placement and to aspirate the stomach contents. Then after that, if obstruction is felt, poke out the tube and try the other nostril. Then, advance the tube. Then, secure the tube with tape and prepare tube holder once stomach placement has been confirmed. Then, connect the tube to drainage, gravity, or specific suction or feeds as ordered. Then, after that, fasten the tube loosely to above client's gown with safety pin. Then, assess the patient to comfortable position and administer oral hygiene and clean tubing nostril. Then, after that, remove the gloves and wash hand and record the procedure. So, now we will proceed to the gabage. So, prepare all equipment and prepare the formula. Check of the expiration date and shake thoroughly. Then after that, always check the position of the client. Then after that, confirm the correct placement of NGP every shift. Then check the residual amount. Then flush with a minimum of 25 ml of water.
Thank you. Ingat.
And check, flush with a minimum of 25 ml of water. Then, administer feed via gravity of pump at prescribed rate. Then, then after that, flush with water volume as ordered using the vigorous push pass technique. Then,
Ano ba ko kayo?
then after that, keep the client's head elevated for 20 to 30 minutes. And after that, rinse the bag and tubing with warm water whenever feeding are interrupted. Then, dispose of supplies and perform hand hygiene. And document the feed hang and flush amount. So now we will proceed to the lavage. So prepare the all equipment and position the patient into the left. Position the patient to the left decubitus position with. Then drape the patient with towel to absorb any drainage. Then after that, verify the placement by attach 50 ml of air in a syringe and inject into the tube. Then ask the client to speak. Place the pen with a pen to the bench. Dito. Hindi nga ko ito ng ano. Natyan mo kanina. Then, place the stomach contents in a label specimen. Paano yan ano? And instill lavage solution using one of the technique above. Then, remove lavage solution as appropriate to the method of administration and continue to lavage until stomach contents when return clear. Then, continually observe the patient for the cyanosis of gagging and attempt of vomiting. Then, after that, when the lavage is completed, clamp the tube if it is remain in place. Then, after that, if the tube is to be removed, clamp or pinch. Then, all of used equipment from the bedside. Then, measure the total lavage, return stimulate the adult of stomach contents record and then discard the lavage solution. Dispose the equipment. Then, assess the patient to comfortable position and administer oral hygiene. And after that, wash your hand and record your procedure in nursing notes. Then, after that, we will now proceed to the NGT removal. So, place a towel across the client's chest to protect from secretion. Then, plus tube with 5 to 10 ml of NS. Then remove the tape to the Then remove the tape to the securement device and release the suction of client tube. Then withdraw the tube gently, quickly, and place. Then ask the client to do the inhale, exhale while removing the tube. Inhale po. Then assess the client through the amount of air. Open your mouth po, sir. Then, after that, wash hand and monitor the client abdominal distension. And after that, document the all findings. And that's all po. Thank you.